Hello, welcome to the fourth video from the core module section of our Urban Polling and Activator online course for allied health professionals. My name is Juliette Fritchie and I will be taking you through this rather short section on other conditions that you may encounter, which you might find that urban polls or activator polls are quite useful for. So we're going to start with arthritis. It's very important with arthritis of the hands, and by the age of 85, 90, the research says that 100% of people will have some arthritis in the fingers or the hands. Very important to reinforce a loose grip. So remember that the reason that we have the core shelf of the hand grip is so that you don't have to grip very, very hard. Having said that, if somebody is getting a lot of pain or they have a lot of inflammation in their hands, that may be a sign that they are not able to cope with urban polling or activator polls. First thing to do though is to just reinforce that loose grip on the poles. You may have to modify their technique based on their range of motion. So if they don't, for example, have a great shoulder range, you might need to not get them to swing so high. And look at a reduced walking time. So we look at about 30% of their maximum ability of walking time reduced by 30%, so that you're really not going to push it. Pacing is important, so they may need to walk at a slower pace for a stretch of their walk, or they may need to just have a bit of a standing rest. The other thing to look at, especially if you're doing outdoor exercises, is to make sure that you have seating available, especially if it's going to be outdoors for a long time, so that they can have a rest in sitting if they need to. So not only reinforcing the loose grip on the handle is important, but also reducing pressure on the ledge. They may not be able to push down on their hypothenar eminence quite as much as maybe you or I can. Modifying the handle is something that might be a useful thing. So if you have occupational therapists, or if you are an occupational therapist, or if you have an occupational therapist in your team, looking at something like a grip wrap or a foam wrap around the handle and around that shelf might give a little bit of extra padding, which might help also. So in this photograph here, you're looking at people doing sitting to standing, and they're mostly elderly and they probably do have arthritis. So they're probably going to be reducing their grip a little bit on the handle, but it's very important for people with arthritis, especially of the lower limbs, to be able to get up out of chairs and all that functional mobility. So it's an excellent tool to use for functional mobility in people who do have arthritis. So osteoporosis is another issue that might be useful to use poles with, or it might be an adjunct condition that occurs when you are dealing with people who might be able to improve their gait with an activator or an urban pole. If they've got a lot of kyphosis, it is useful to decrease the height of the poles to start with and increase gradually. It's a really good activity because it does provide that little bit of resistance training, especially in the upper limbs, and does improve posture. But the other thing is that if osteoporosis is, if they have other comorbidities, it's a really nice way to get them exercising, to get them increasing their endurance, their strength and their functional mobility. Respiratory conditions, I personally have found a number of, I've had a number of successes with respiratory conditions. So things like COPD, asthma, chronic bronchitis, emphysema, that kind of breathlessness that people get, asbestos plaques. So this lady on the right has asbestos plaques, which were impeding her exercise tolerance. It's a really good way to improve your exercise tolerance. Start at 30% of your maximum and gradually work up. The idea of when you do use poles, you're actually fixing your rib cage and your diaphragm decreases, lowers a little bit. So you do have that little bit of extra ability to get a deeper breath when you are walking. Pacing, again, is very important. So making sure that they don't over exercise, especially at first when you're first trying it out. And the usual things of making sure you're on level ground and you're not increasing the burden of their lung capacity. Indoors is a great way to start, but people do quite well with urban poling and chest conditions, often because it does help them just get that extra exercise tolerance in. So here's spinal stenosis. The lady on the left has had rods inserted for spinal stenosis. She's actually on a slope, so the poles look a lot shorter than they are. They're really good for spinal surgery because they get you upright, so you're not leaning forwards onto a walker. You might need a walker to start with, but not necessarily if you have good, relatively good balance and strength in your lower limb and trunk. Really nice to get all those lovely trunk muscles, core muscles working. So you can look at using it between 28 and 48 hours. Some people, it works very well with. Again, commence walking at that 30% of tolerance and gradually build up. So a little bit to start with, get a little bit more. They might require slightly lower poles initially. My experience is they actually like the poles up so that they can really get that nice upright posture. And it also is one of the few walking aid techniques that allow you to really get your hip extensors working, and so that's really important for these people. Mental health, start with an activator technique if there are cognitive or if they've got physical changes. Don't forget, a lot of these people have comorbidities, so you have to look at the whole person, not just at one particular aspect of them. Be a little cautious if judgment or is impaired, or if there's aggressive behaviour. And don't overthink things. Sometimes an intuitive way of getting people walking is much more helpful than frustrating them. And if people are not able to get the technique easily, then it may be worthwhile just giving it, not rather than pushing it in one session, trying it again, leaving it aside and trying it again in another session. Don't try to get a perfect technique to start with, just that left, right, left, right. It's such a lovely, rhythmic, meditative activity to do that it is, it could be quite a useful tool for people with mental health issues. Also remember that green exercise aspect of walking. So if you can get people walking outdoors, then so much the better. And a group works really well for these people, social exercise. Multiple sclerosis is similar to Parkinson's disease, stroke, and acquired brain injury, in that it gets nice symmetrical use of the poles. It keeps people upright. It's a really good postural technique, and it allows you to heel toe much better than if you're not using any aids at all. It may be that a client may be using a stick or a walker for a primary mobility tool, and they may use the Activator poles just for an exercise tool or in the clinic to work on certain aspects of their gait. So use the Activator poles like this gentleman on the right is doing if stability is an issue for walking. And you can also use the Activator as a really nice stability tool when you're doing exercises, stepping, pre-gait, pre-standing, stepping, breaking down those gait patterns. It can be quite useful to work that way. Cardiac rehab, it sort of depends on comorbidities, and it also very much depends on what their precautions are and what they have been prescribed by their cardiologist. So very important to remember that you're actually increasing cardiovascular workout when you are polling. And so you need to start low and build up slowly. And you may need a heart rate monitor just to get that idea of where they're at with their cardiovascular load. Follow your clinical guidelines. Some people may, especially if they've got comorbidities, it may be a useful thing as a walking aid for balance. For example, if they've got arthritis, if they've had hip issues, if they've got stability problems. So thank you very much. That is the end of this. Don't forget that if you go to the Urban Polling website, under education, there are a whole lot of free webinars specifically on many of these shorter issues and medical conditions, and that would give you more detail on how to use activators in this area. So thank you very much, and we will catch up with you another time.